Okay, the time being 9 a.m. Wednesday, April 21st, 2021. I'd like to call this meeting of the Kane County Public Health Committee to order. I am Chairman Jared Sanchez. Clerk, could you please call the roll?
Silva?
Here.
Thank you. Lewis?
Lewis here.
Shepro? Strathman?
Strathman here.
Kepi?
Kepi here.
Weber?
Weber present.
Ninjas. Pirog?
And for those watching at home, it is our policy that when people are at their workstations and more than 6 feet apart, they can remove their masks. And with so many people being vaccinated now in the county board, we can be assured that we are following proper protocols and you can hear me better. So, all right, moving on. We have approval of the minutes from March 17th, 2021. Can I have a motion and a second, please?
So move.
Mr. Tepe moves.
Lewis second.
Lewis seconds. Any questions, comments, additions, or deletions? Hearing and seeing none, clerk, please call the roll.
Lewis?
Yes.
Shepro?
Yes.
Thank you. Strathman?
Strathman, yes.
Kepi?
Yes.
Weber?
Weber, yes.
Silva?
Silva, yes.
Thank you.
Okay. Finance and budget. Our financial reports are on file. Does anyone have any questions about them this month? I believe our finance person, Cannell, is with us. Not yet, but anyway, hearing and seeing none, we will move on to public comments on agenda items. I'm not aware of anyone signed up for public comments. You want to give a comment? Nope, just observing. All right. Okay, let's go next to animal control.
Good morning, everyone. How are you today?
Good. How are you, Brett?
Very good. I just want to take a moment to review our finances from this last month. You will notice that our expenses did exceed our revenue. This is because our floors that have been redone, it was budgeted for this year, were just completed and that bill went through. We did have the funds completely to pay for this. It will not affect our operations in any way. It just happens to be this month expenses exceeded revenue. Thankfully, all of our other months revenue always exceeds expenses, so we're still in the black, doing wonderful as a department. The other thing I wanted to mention is that our first drive-through vaccine clinic will be this Saturday. Knock on wood, it doesn't rain like they're expecting, but we have a rain protocol in place that we'll still be able to handle as a drive-through vaccine clinic to make sure everyone's safe, distanced, and protected. That's all I had this month other than the resolutions. If anybody has any questions for me.
Anyone have any questions for animal control? Okay. We have two resolutions. First, the deputy administrator position. I don't know if you wanted to add anything to that, Brett, or if anyone has any questions.
This is actually just a housekeeping issue. Our veterinarian on contract has always been contractual. Part of the DEA requirement is actually to hold controlled substance within our facility. That person must be on staff. So instead of having them contractual, we're actually going to move them to a seated position. This position is 100% funded. It's always been funded. We're just moving the money from contractual to payroll. It is a part-time position, so there are no benefits. It does meet all the county criteria to stay at the 11 hours that we need. This will also allow us to utilize the county veterinarian more for hoarding situations, for other situations that we need to bring the county veterinarian in. So it's going to allow this department more flexibility and ability to do more with that position.
Okay, I need a motion and a second to move. Mr. Tepe moves.
Strathman second.
Strathman seconds. Any discussion, any questions? Hearing and seeing none, clerk, please call the roll.
Lewis?
Lewis, yes.
Shepro?
Shepro, yes.
Strathman?
Strathman, yes.
Kepi?
Yes.
Weber?
Weber, yes.
Silva?
Silva, yes.
Okay, then next resolution, Administrative Officer 2 position rehire. Can I get a motion and a second to discuss and potentially pass this resolution?
So move.
Weber,
Mr. Tepe
Weber
moves,
second.
Weber seconds. Brett, do you have anything to add to this one?
Yes, I would. Lynn Elberg has been with the county for 47 years now. This is a very sad moment for our department, a very exciting moment for her in her life. She did not want to come before the county board, otherwise I would have brought her in there today, because 47 years is pretty amazing inside this county. She's seen a lot. She's watched this department grow from the ground up, and we cannot thank her enough for her amazing service inside this county, let alone her amazing service within this department. Again, this position's fully budgeted. It's just a rehire. We're just sad to lose someone that's been absolutely amazing within this county.
Any questions on this? It's always sad to see good people go, but such is the way of life. So I always wish them well. All right, clerk, please call the roll.
Lewis,
Lewis, yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Tepe,
Yes.
Weber,
Weber, yes.
Silva.
Yes.
Thank you.
Okay, next we have the executive director update. Ms. Kathy Foster is on the line.
Good morning, everyone. So I wanted to start out with, before we go on to COVID-19 updates, I wanted to give you an update and bring you up to speed on, because apparently there was some confusion in the last county board meeting, which I apologize, I was not there. I was tending to the whole J&J situation, because that's when the story broke that they were pausing J&J. So, and we had clinics that we were running that we had to change and assess the situation. So I wanted to make sure that I cleared up everything about the temporary assignment pays that came up in the county board, because there was a lot of questions. And I just wanted to make it clear that there was no county board action to be taken at the time that the Kane County Health Department's budget was approved for 2021. We were not asking for a line item, like a budget line item change. We're not requesting additional funds. So we have funds in our budget because of existing vacancies. And actually, Michael, could you bring up, I have the org chart. So if Michael could get sharing, yes. So here's our organizational chart, and you can see like in the yellow boxes that those are current vacancies that the health department has. Some of them you'll see, I tried to make sure they're in purple so you can see. And I consulted with Kenel Snowden, who's our director of finance, to make sure that the funds were intact. I never would have asked for temporary assignment pays if I thought it was not sustainable. So I just want to make sure that that's clear. And, as you know, this was done last year. I think most of you know, it was done last year, and it was under a CARES Act funds, but it was done across the board, and it was done last year. Our people have been working, as you know, tirelessly over the last year. We've been under severe stress, missing family time, losing vacation time, holiday time during this pandemic, with the goal to serve, in public health, to try to do our very best with what we have to protect the residents of, protect the health of our residents. Throughout this pandemic, we continue to work under, treacherous circumstances, being chastised, threatened, called names, yelled at. We've comforted many families during case investigations who's lost family members. All the information is always changing constantly and evolving with the disease mitigation, the vaccines. We're always trying to stay on top of things, move ahead for the, to serve our community. I'm very proud to work side by side with all the fellow public health workers. The King County Health Department's truly amazing, really. And in my personal opinion, it is the county's greatest, most precious asset that we have in working tirelessly for this pandemic. So I just feel very strongly that we reward those working very hard during this pandemic. I know there's many other people, but I'm just looking at taking care of, our people during this pandemic as well. So I just wanted to say that and go on record and say, that's the information I have. So.
Thank you for that explanation, Kathy. Does anyone have any questions on this issue? No? Okay. All right. Thank you, Kathy.
All right. Okay. So, Michael, let's talk some more about COVID.
All right, thank you. And I'm just switching screens here. Okay, there we go. So thank you. Good morning, everyone. I'm Michael Isaacson, Assistant Director of Community Health at the Health Department. So we have some really positive news with COVID, and then we have some things that we still want to watch for, and just reminders that we're not quite out of the woods yet. So I'll start with just some of the basic information that we share at all of these updates. Typically, I show a 30-day view, but here we're looking at test positivity since last summer, because I think it's interesting to just see the whole trend. So you can see the peak that was occurring, started in November, December, where we had our highest positivity ratings where over 16% of the COVID tests were coming back positive. Here, I just wanted to show for comparison, the month of April was really, we've been on a bad trajectory, and our test positivity went from 3% on up over 8% again. In Kane County, we've been hovering right around 8% for the last week or so. You can see this little orange line here shows that there's starting to be a decrease. So we're certainly hoping, and with the really successful vaccine campaign we have going on, we're hoping that this is actually the downward turn and that this little spike is over. But just wanted to show people that this past month, we're not done with COVID. There's a lot of virus still circulating in our community. Way too many tests are coming back positive. So again, as a reminder, this is data for Kane and DuPage County, what we call Region 8 here in Illinois. So something to keep an eye on, and hopefully this downward trend that we've seen the last couple of days will continue. Looking at hospitalizations, and again, just a reminder that sometimes these things can go in order, where we start to see an increase in positivity, so an increase in cases, then we'll see an increase in hospitalizations, then we see an increase in deaths. So as we look at this data, and this was updated yesterday, over the past month, we've seen an increase in hospitalizations across the Kane and DuPage region almost every day in the past month. So 24 of the last 30 days, we've seen an increase. And you can see here that the 5 of the days that weren't increases were almost a month ago. So we're still going the wrong direction there. But again, as that positivity starts to bend down, we're hoping that the number of cases is going to start to go down in our hospitals as well. And unfortunately, our ICU, those people who are sick enough to need intensive care, that's also been on the increase. So it's something that we're watching very closely. Fortunately, we have not seen an increase in deaths, and the numbers each week over the last couple of weeks have been better. So we're still losing our residents to COVID, but it's been less than 5 the last several weeks. So that's good news. So we want to encourage people to continue wearing their masks. We want to encourage as much social distancing as possible, and we want people to go out and get the vaccine. So the hospital number trending in the wrong direction, but with cases going down, we're hoping that we can get this righted here pretty quickly as well. So that's the bad news. Now the rest, I'm going to talk about things that are a little more positive. Our vaccine campaign here in Kane County has been extremely successful. We have over 315,000 shots that have been administered to Kane County residents So this is as of yesterday, 316,497. So that's a lot of shots that have been going into people's arms. The chart here, every blue vertical line is a day. And then the orange line is our 7-day rolling average. And so we're averaging over 5,500 shots being administered to Kane County residents per day in Kane County. So that's really fantastic. We're making quick progress. You can see over here, and this is taken from the Illinois Department of Public Health webpage. We have almost 125,000 people who have been fully vaccinated. And percentage-wise, the state reports that out as 23%, but that's of our entire population. So when we look at people who are eligible for vaccine, so everybody who's 16 years old or older, we're coming up on over 30% who are fully vaccinated. And then every day we're giving people their second doses. So we're getting more and more people who are fully vaccinated every day. So our speed at which we're getting people vaccinated and our capacity is just really exciting and really positive. So a couple things going on. We want to make sure that we make vaccine available for all of our residents. The Kane Vax Hub, as you know, opened on March 19th. We vaccinated over 30,000 people at that site, so that's been fantastic. On April 2nd, in partnership with the city of Aurora, we opened the site at the old Carsons on Lake Street or Route 31. That's been very successful and highly effective site as well. And then on April 7th, we partnered with the city of Elgin and Cook County to open a site at the East Side Rec Center, where we've been able to vaccinate a lot of people. That's a very busy site as well. So now we have 3 sites that are up and running. Our capacity is strong, and we're encouraging everyone over 16, like I said, to get in and get a vaccination. Going to canevax.org is how people can make appointments. We're starting to get to the point now where there's more appointments available, which is going to make it a lot easier and a lot less frustrating for people. So we have, just on Monday evening, we released over 20,000 appointments for the week. So there's a lot of capacity, a lot of opportunity for people to sign up for shots. And then if people don't have access to a computer, they can call 855-4-KANE-VAX and make appointments through our call center. We're also working with community partners to do specific events, either at employers or more specifically in neighborhoods, at churches, so that we're able to reach people. Just kind of closing the loop, I didn't actually include a slide for this, but previously we'd had a lot of discussion around seniors. And in Kane County, we have almost 80% of our seniors have had at least one shot. As you remember, we worked with many of the organizations that serve senior populations, and we gave them special codes so that they could sign up seniors who didn't have access to computers. So that process was incredibly successful, that we have such a high rate of our seniors who've been vaccinated now. We're getting out, we're working with community partners to vaccinate the homebound seniors. And now we're trying to work with seniors who maybe have opted not to get the vaccine to try to encourage them to get the vaccine. But currently we are working through all of our waiting lists with almost every organization I talk to now. They no longer have waiting lists for people trying to get vaccine. So that's a good thing to see. And then, as I mentioned, we're working not only with our pharmacy partners and our clinical partners like VNA Healthcare, but also working with the Illinois Department of Public Health's equity team to do more on-site initiatives. Over the next week or so, we are going to continue to make some extra vaccine available for students in colleges, because we want to make sure that there seems to be a fair amount of transmission in that age group. So we're working with the different community colleges and universities here in Kane County to make special opportunities available for them as well. So lots of really good things going on the vaccine front. Here's a look at what our canevax.org website looks like. So just a quick tour. The first thing you come to is choose your vaccination location. So people can choose if they want to go to the Vax Hub in Batavia or Aurora or Elgin. Once they click on that, they come down here and they can see each day which vaccines we have available. So if somebody has a preference, they'll be able to choose which day they want. Kathy mentioned the Johnson & Johnson vaccine, so that was a bit of a hiccup last week. We do want to assure that we're making safe vaccines available to people. We anticipate that we're going to get further information about that in the next few days, and then hopefully after they review all the data, they will find that that vaccine is safe, and we'll get the Johnson & Johnson vaccine back into circulation. If for some reason they determine it's not safe, then that's actually just proof that our process works. And so we'll be able to continue vaccinating with the other vaccines that we have available to us. But either way, we're seeing people have great outcomes from this, and these vaccines are highly effective. So we're just really imploring people to get vaccinated. We're kicking our outreach into high gear now, working with other community partners to get out into the neighborhoods to help groups that may be resistant, so that they can register, so that they have information that they really can make the best choice for themselves. Everybody has to make their own personal choice. So we just want to make sure that we're giving them the right information so that they have a good understanding of what the positive impact of more of us being vaccinated is. And then I just wanted to share, we've been working with TAG, our communications company. Here's just a couple 30-second videos that highlight some of the things that are going on in the community. And actually, I apologize, I'm going to stop sharing and start again just to make sure that I'm sharing the sound for these videos, because I don't think I clicked that box. Okay, so now here's just two really brief videos that highlight what's been going on at the Batavia Vaccination Hub.
I'm really excited. I'm really relieved about it. It's my first dose, and it'll be nice to kind of get back together with family and friends within reason. The doors opened promptly at 9, and the line moved very, very quickly. The people that were helping out, the volunteers, the guard, the police auxiliary have all been extremely friendly, professional, efficient. The line moved very, very quickly, and it just turned out to be a good experience. It ended up only being maybe 20 minutes, a half hour, and everything was done.
So there is one, and then I'll just show, here's the second one. Again, just a 30-second or so video.
And it went so quickly, so smoothly. I was very impressed. I think it's important, if something were to go wrong and you didn't get the vaccination and it's readily available to us, it'd just be such a loss. So I would recommend it for sure, especially for someone with underlying conditions. It's just one less thing to worry about.
So again, those are just two videos I think that were really well done. A couple things that they show. One, it highlights just the staff, as Kathy mentioned, the staff working at our clinics are working very hard to make sure that people are able to have a good experience and get their vaccine. When people show up, it can be a very quick process, so that's good. People tend to show up early in the day, so there may be a line right at the beginning if people show up. But we have appointments scheduled every half hour and can work through. So typically there's not much of a wait, and around the half hour is what most people are reporting to us that they're waiting. Also, I think this video highlights that, it's a simple process for people to do, and it protects not only you, but also those people around you. So we do have these videos available. We have more testimonials. These are just residents who were interviewed at the clinic that just sharing their personal experience. They're not actors. So it's great to hear from actual Kane County residents about the process. And then also we have these available in Spanish, and we're working with the Laotian community in Elgin so that we can have videos available that really will reach our Kane County residents to try to encourage them to get vaccinated. So just a couple closing points on the vaccine. The vaccines are safe. So millions and millions of people are being vaccinated without adverse effects. They protect not only you, but protect people around you. When we get to that herd immunity, that's going to be very big for making sure people are safe. The quicker we get vaccinated, the quicker our businesses and employees can get back to normal. So this has been a hardship on our businesses. It's been a hardship on our workers when they have to be out for quarantine or because they themselves are sick. So the best way to address that is to get people vaccinated so that we can really assure that moving forward, we can support our economy and our families as much as possible. And then the most important thing is it protects families. So people who are losing loved ones, who are dealing with economic hardship, who are dealing with being in isolation. Once we get people vaccinated, we can get past that and start to move to more normal. And that just one last message, I just want to plant a seed for today, and that's to talk about mental health. This has been an extremely tough year for everyone, around the world. So specific to mental health, we all have seen the stories, and we all know, and we're all going through it ourselves. We're losing loved ones, seeing people sick and lose their lives. People have been isolated, especially our youth who have been held at home doing schooling remotely. Our senior population who we talk frequently about, people who haven't been able to hug their grandkids in a year. The vaccine is a way to deal with that, but we're going to need more supports around mental health for all of us, for all ages moving forward. People have had job loss. People have unfortunately returned to drug use because of the stressors. We hear about that from our treatment providers. And then you may see the reports from the state's attorney's office that we've seen increases in child abuse. And April is child abuse month. Got the little thing, I don't know if you can read it over my shoulder here. But this is something that we really want to pay special attention to because of these stressors on our families. So just a quick note, we did do our community health assessment. Mental health was identified as the top priority again. So this is something that we need to continue to put resources into and continue to support. We do have a web page for our Kane County Behavioral Health Council, which is wesupportmentalhealth.org. And then also, I'll just close this section with, we currently are doing what we call a Photo Voices project with our youth, where we meet regularly with the Kane County schools. And this is an opportunity for young people to show their artistic side and talk about mental health. So they can take photos, they can provide art, they can give us things that show their impressions of mental health and how they're feeling. So that's something maybe next month we can come back and share some of the things. We're just collecting them now. But just really we want to engage the young people. But as I mentioned, young people, seniors, all of us in between, we all need some additional supports for mental health in the coming months. And then finally, the slide we always close with, and I'll put a little disclaimer on there, for just a little while longer, please. We want people to wear their masks. We want people to social distance. The finish line is in sight in terms of getting people vaccinated. So if we can continue with the successful vaccine campaign until we get enough people vaccinated, it's really important that we're still watching our distance and wearing our face coverings. And with that, I will open up to questions.
Mr. Tepe.
Good morning, Michael. Vern Tepe here. Couple of key questions that are a little bit disturbing to me. A week ago Saturday, there was a special vaccination site in downtown Elgin, and at the end of the day, they had 200 doses available that people hadn't asked for. And I went last night and just vax.org, and there's just a tremendous number of appointments available. Are we having challenges where people are not going and getting vaccinated?
I think we've just hit that point, and it mirrors what's going on around the country, where we are switching from being overwhelmed by the demand and not having enough supply. And then just last week, we didn't know when it would happen. We knew it would be somewhere in the next couple of weeks, but we seem to have hit that point where the people who desperately wanted a vaccine have now been able to get it. So we're switching to from my perspective, to what's more of a traditional public health role, where we're going out into the community and working with community groups. So I think maybe, at the end of last week and a little bit this week, we see those appointments hanging out there a little bit more. That's why it's going to be more important for us to go and work with the churches to get them to come in big groups, to work with our social service providers to get them to be signing people up on site. So we have staff who are going out where people are, especially with an eye on health equity, to go into the neighborhoods, and we're actually signing people up on the spot so they can go to these appointments. And we're scheduling other clinics where we can actually send clinics to be on site at different places. So right now is the transition. Absolutely.
Yeah. And I thought those 30-second ads were really quite impressive. Okay. So I don't know what we can do to help get it out there. But we just need to get people vaccinated, and I'm starting to see some resistance. And to me, it's a lot faster than I thought it would be. I figured once you opened it up to 16-year-olds, you would have that place booked so fast it was crazy, but it's not happening.
Right. And part of it's a good thing that we have so much capacity. So as we've built capacity, and then it's, now we've reached the point where the demand is evened out. So it's good that we have this capacity. But yeah, we're working with the school districts to encourage the 16, 17, 18-year-olds to get vaccinated. I mentioned we're working with the colleges to get those young people vaccinated. We're working with manufacturers and employers. So we're trying to get out and hit all the key groups, definitely.
Okay, is that vax number that you had on the slide, is that the one that somebody would call if they were homebound?
Yes,
Okay.
Absolutely.
I'll get that.
And right now we're partnering with VNA Healthcare, and their home health nurses are going out and providing the shots to the homebound.
Okay.
Mr. Chairman?
Thank you.
Mr. Ethman, go ahead.
Yes, I just wanted to say that last week I had the opportunity to volunteer at one of the clinics, and it was such a positive, feel-good situation, meeting the needs of the public, and everybody, first of all the volunteers were happy to be there. The people who came in to get vaccinated were in a good mood. They were happy, they were relieved. And it was such a great experience. I have signed up again to do it this next week at the Vax Clinic in Elgin. And I would encourage anybody who has some time, not that we aren't all crazy busy, but if you have some time and you want to feel like you're doing a good service, I recommend trying to volunteer at one of the clinics.
That's all the reports I've been hearing. It's all good news so far. Ms. Lewis, go ahead.
Good morning, everybody. First of all, I'd like to thank Michael and Kathy and you, Chairman, for all the hard work. Kathy, the speech that you gave in the beginning is everything that we all echo. You guys have worked so hard. I have no idea what you guys have put up with in the last year and a half. However, I know that you have certainly done it at a great personal sacrifice. So I thank you and all of your staff. I know that on a normal time, you guys are super, super busy. So I just can't even imagine now. So thank you all very much. And then I do have one question. We used to get a slide that showed our positivity rate by like demographic, like, it was the seniors, and then it shifted to like the 30-year-olds, and then kind of in the late 20s. Are we seeing that rate kind of shifting to the like high school kind of kids and grade schools as we start having them, go back into classes?
And I'll defer to Uche Anwuda to talk about that shift. Yes.
Okay. Also, Uche, thank you for everything you do. I did not realize you were on until right now. So I didn't mean to ignore you or Canal, because you guys also are amazing. Sorry.
Thank you, Ms. Lewis.
You're welcome.
Yeah, we're seeing a lot of cases in the 20 to 29-year-olds. And actually now we're seeing deaths in the I mean, we had a death in the 30s last week, I believe in the 50s. So what happens is now that many of the seniors have been vaccinated, you know, the younger age groups are the ones that are more affected at this time. So it just shows that we have to keep working and, you know, keep getting the word out to younger people because they feel like they're invincible. But we really have to get them, in order for us to get that herd immunity, we have to get them vaccinated.
Right. We might want to consider doing a 30-minute targeted video to that age group too, because they're the ones that, if they read it on Facebook, we know it's true, you know, and they're the ones that are also worried about, because, you know, they're going to turn into a zombie if they get this shot. I heard that from my granddaughter, and well, it hasn't happened to me yet. So, but okay. Anyway, thank you for the answer to that.
Thank you.
Thank you, Ms. Lewis. Any other questions or comments? Okay.
Mr. Chairperson?
Oh, yeah, Dr.
Sorry.
Silva.
I had my hand up. Yeah, so Mr. Isaacson, congratulations on your Healthcare Hero Award from Aurora. I happened to be at that meeting, was it a week or two ago? And I was very proud to have worked with you all this time in serving our 530,000 residents. So congratulations on that. And I have to say something, you know, with after Ms. Foster's such accurate statements at the beginning. You know, you've done such an amazing job for us, the staff, and I think Ms. Lewis really hit the target when she said at such a great personal cost. The professionalism, I have been stopped by my constituents in District 7 to tell me how great things have flowed when they have received their vaccine. I know Chairperson Sanchez and myself, we've met with some of the staff, and I invite fellow board members to reach out and to also be responsive when they meet. At the end of the day, everyone does a phenomenal job. So I think it's incumbent on us that that we continue to provide you with, as legislators, with the support that you need to make this difference. So really, at the end of the day, what matters to continue to have you make this difference is great benefits and competitive salary. And I know that we can never compare and we can never repay you for what you do, but in the background, we have to keep that in mind as legislators, that we have to provide you with the working conditions where you're able to support our community, because it really is you who has kept us afloat this whole time. I didn't know heads from tails, and Public Health Department staff is the one that has really just kept us in line and has been able to answer questions. And sometimes it wasn't a fluid situation. It didn't flow easily. The situation was so fluid, but everyone brought together their knowledge and their experience, and together we've had such amazing results. So that's all I wanted to say. Thank you.
Thank you, Dr. Silva, and I certainly echo those sentiments. All the hard work the Public Health Department does is not unnoticed, and hopefully will continue to be noticed even more going into the future. Any other questions or comments? Okay. All right, thank you for your updates, Kathy and Michael. And we do have a resolution, authorization to purchase naloxone with funding from Illinois Department of Human Services. Can I have a motion and a second to discuss and potentially pass this resolution? Anyone?
Weber will move.
Weber moves.
Lewis will second.
Lewis seconds. Kathy, this is just our standard naloxone purchase, right? Nothing unusual about this? Oh, she's still here. Yeah.
So
Okay.
I'm sorry, I thought I must have muted and unmuted again. Yes, and this is under, Michael, this is under your grant.
Right, so we did receive
Oh.
some additional funding from the Illinois Department of Human Services. So we're able to increase, and we're doing some creative outreach with our naloxone program. We're starting to pilot some what's called leave behind programs with local police departments so that we can try to reduce overdose deaths even more. So, but otherwise, yes, this is our basic purchase.
Mr. Tepe.
Being somewhat new, who all does this get distributed to? I mean, do you distribute it to 501c3s in addition to the police departments?
Yeah, we distribute it. The goal ultimately for the state opioid response plan is to get the naloxone as close to an active drug user as possible. So we started the program 7-8 years ago, working with police departments, and we've expanded it. So we share naloxone with schools, with social service providers, with mental health agencies, just trying to get it out to people so that if somebody does have an overdose, there's naloxone close. We really view it, unfortunately, it's like an AED where it's something in our society that we need access to it for people who may be struggling. And as I mentioned, with the stresses of the past year, unfortunately, we're anecdotally hearing from our providers that people are relapsing and are returning to drug use. And of course, with pain medications and things like that, opioids continue to be a major issue.
Okay, thanks.
Yeah, before COVID hit, I was looking forward to addressing things like the opioid addiction problem and mental health, because those were our two biggest issues that we identified, and they haven't gone away. So it's very important that we're still able to continue doing at least some work in this direction, provide the Narcan and the naloxone for our community. So thank you for turning in the grant paperwork and keeping us on track with this. Any other questions or comments? Seeing and hearing none. Clerk, please call the roll.
Lewis,
Yeah, I'm all for saving lives. Yeah, absolutely, yes.
Shipro, Strathman,
Strathman, yes.
Tepe,
Yes.
Weber,
Weber, yes.
Silva,
Yes.
Do you recall, Shepro, I had my mute button on?
Mr. Shipro.
Yes.
Thank you.
Okay. I have nothing under old business. Can I have a motion and a second to place reports on file?
So move.
Mr. Tepe moves.
Second, Shepro.
Shepro seconds. Questions, comments? Hearing and seeing none. Clerk, please call the roll.
Lewis,
Lewis, yes.
Shipro,
Shepro, yes.
Strathman,
Strathman, yes.
Tepe,
Yes.
Weber,
Weber, yes.
Silva.
Yes.
Okay, we have no need for executive session. Under new business, I really don't have new business, but I did have a couple brief comments. One, we are working on a vaccine site in Carpentersville still. We're not able to really give any details on that as far as when it will open and where it will be at, but we're getting very close to being able to announce that. We're working with local pharmacies to populate that site. I know all of the other ones are National Guard sites, but for right now, we're going to be running it ourselves in conjunction with local pharmacies. So things are looking good on that. I keep getting questions about a Carpentersville site, so I figured I might as well give at least some update on that here today. I was hoping to have a presentation, someone to come give a presentation on vaccine safety, how we know they're safe, and addressing some of the myths and rumors about vaccine. But the scheduling was a little tricky to begin with. And with finals this week, a lot of professors are busy. So I don't know that will be coming to this committee, but I do hope to organize some type of public Zoom event and have somebody with a lot of very direct experience in the epidemiology and the fields that are relative to COVID-19 to come speak to us and answer some questions, make things a little more clear as far as the safety of the vaccines, and really addressing some of the misinformation, the disinformation, the rumors, the lies that revolve around vaccines. And that if you look at the history of vaccination, there's always been an anti-vaccination crowd that does whatever they can to persuade the public in their direction. Recently, we had the Johnson & Johnson issue come up where, just, what is it? Over 1 in a million people have a chance of having issues with blood clots. And 1 in a million is a very small number. Just for some perspective, for opioid deaths, you have a 1.04% chance of dying from opioid. You have a 0.69% chance of dying from a fall. You have a 0.01% chance of being struck by lightning. And a conservative number of, you have a 0.00006% chance of having any blood clot related issues with the Johnson & Johnson vaccine. So people, I heard a lot of talk saying, oh, look, they're recalling this. We're going to have blood clots and, you know, the vaccines aren't safe. But the reality is that is such a small number. They pulled it because they are being so very careful in the safety of these vaccines. For just over 1 in a million chance, they're pulling it off the shelves. With the Pfizer and the Moderna vaccines, they have not done that. And if the claims that these things are so deadly and so dangerous are true, then I think our government agencies would have pulled those other 2 vaccines as well. But we're not seeing anywhere near the adverse reactions we saw with the Johnson & Johnson, which again is 0.00006% chance, whereas getting struck by lightning is a 0.01% chance. So I think we'll see the Johnson & Johnson vaccine come back, probably with some precautions for people on certain medications perhaps, or, you know, they're figuring out what the details are. But as far as we can tell, the vaccines are very safe. So we have to keep continuing on under that understanding and get out there when you can and get your shot. So that's it for me. No public comments on non-agenda items. Okay. I need a motion and a second to adjourn.
Move to put reports on file.
Oh, we did that.
We did that. I moved to adjourn.
Mr. Tepe moves, Mr. Weber
Strathman.
seconds.
Mr. Weber will second, yes.
This is Mr. Weber's last meeting with us. Thank you for being a part of this committee, Mr. Weber. I almost forgot to say goodbye.
Oh, gosh, I don't like to be recognized for anything, but yes. And I'll still be around. I'll just be working at the city level, not at the county level, like your big shooters.
Yeah, we'll be in touch, definitely.
All right, thank you.
All right, all those in favor of adjournment, say aye.
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 All those opposed, still go home. All right, thank you everyone for being here.